your baby is very tiny and you're worried that something's wrong. And so a lot of parents get concerned if with what they think is constipation, and end up even going maybe to the emergency room. And while our ERs, we try to keep clean and try to keep germ free. I mean, there are people that go there who are very sick and have different illnesses that one could potentially catch if they aren't careful, and just inadvertently. And so I really try to keep babies out of the emergency room, as best as we can, just to help protect them until their immune system's a little bit older and a little bit more able to take care of things. So newborn babies, of course, stooling patterns are very different for every baby. Frequently, right after birth, they stool very often. That does slow down, so we usually try to say, a stool per numbers of days old. So when your baby's 2 days old, you should have at least 2 stools, and when they are 3 days old, at least 3. And then most of the time what happens if you're breastfeeding is breast milk does have a natural laxative, and so babies frequently stool almost every time they eat, starting within the first week to 2 weeks of life. Babies are born without a lot of bacteria in their gut, and now everybody talks about probiotics and how important that is to normal gut health, and babies have to takes time for those bacteria to kind of build up in their system and be there to help keep everything regular. And their stooling patterns change. So a lot of parents think if their baby does not poop every day, that their baby is constipated. A lot of that is from the fact that putting your feet on the floor kind of straightens the last part of the colon. It makes it easier to go. And babies, of course, don't have that. They aren't able to sit up and sit and help, and their tummy muscles are, weaker. And so a lot of times they'll be pushing and grunting and turning red. And, you see those belly muscles really working. And it's not because they're constipated, it's just because it's hard to poop as a baby. And so, they'll end up going to the emergency room when really they could have probably just, even stayed home, called the office. We'd be more than happy to, bring them in and weigh them and see how they're doing. And so kind of, as far as newborn stooling goes, of course, most of the time what happens is they start slowing down. They stool less often. Some breastfed babies, the breast milk's so well absorbed, they may even poop just one time a week, and that's okay. And that's okay for kind of what you watch for, as far as several things to look for with constipation. And if your baby isn't stooling very frequently, do they seem pretty happy? If they seem pretty happy and they're still eating, if they're still gaining weight, so that's sometimes we bring them in and do weight checks. And then, of course, if babies are still getting enough in and taking enough in, they'll still keep peeing. So knowing that your baby makes at least 6 wet diapers a day is reassuring. Now, at any point, if the baby ever has hard stools, then yes, that is constipation and that is abnormal. And you'd want to contact the office and get in with your pediatrician and see what you can do about that, because they shouldn't have hard little pellets at all. So one of the reasons, there are definitely reasons to go to the emergency room. If your baby's stomach is very hard and very distended and it stays that way, then you definitely need an emergency room visit. If there's, of course, everybody knows babies spit up a lot, but if they're throwing up anything that's bright green or has a lot of blood in it, you should definitely bring your baby to the emergency room. And then if they're having a lot of blood in their stool, little flecks of blood are probably okay, and you could call our office. But if they're having a lot of blood in their stool, they need to go in as well. So if they're really uncomfortable, really fussy, their stomach is just rock hard and doesn't relax, and then, of course, if your baby has a fever, you definitely need to come into the emergency room. And then the reasons why we try to keep you out of the emergency room, of course, are I mean, of course, now everybody knows there's COVID, but there's also, flu, regular colds. I mean, your baby's immune system doesn't really get fully revved up and charged right away. And that's why we have to do so many vaccines at the 2, 4, and 6 months visit, is just because a lot of times to get their immune system to be ready to fight things off, they have to get those boosters to get the levels up. And so even if you come into the emergency room and you're careful, I mean, sometimes you can be exposed to things, and we just try not to let babies can get sick really easily because that immune system isn't ready. Some parents think because they're pushing and grunting and turning red and they haven't stooled in a day that they're constipated, up to 2 days. But, like I said, as long as they poop like once a week and it's soft and they're gaining weight and they're peeing really well, usually we're not too concerned. Formula fed babies don't, because that formula, of course, doesn't have the natural laxative that breast milk does, tend to poop less often. A lot of the sensitive formulas tend to also make them stool less often. And so I'm not, that's why some of the sensitive formula babies, you have to really watch for those hard stools and actual constipation, because the formula tends to not move through as quickly. So most of the time they think their baby's constipated, but because they're not having hard stools and they're gaining weight and they're pooping, they're not actually constipated. So sometimes we do worry that, you think your baby's constipated because they're not stooling and they're not pooping very often. And then we bring you in and find out they're just not getting enough probably to eat because they're not gaining weight very well. So if they're not getting enough breast milk or formula intake, they cannot poop often enough. But if the poop comes out and the poop is soft, there's no blood, no mucus, as long as they're stooling once a week, it's actually usually okay. So here's some of the tips and tricks we can try to help keep you hopefully out of the emergency room and safe and at home. So the first one is just, of course, the way she holds Kira. She just kind of brings her up and close, and then she kind of just brings those little feet up. And so having the feet kind of in that little squatting position right there, kind of helps straightens out the colon, of course. And then if Kira were like angry and fussy and crying, that of course helps put pressure on those tummy muscles and can help get some of the stool out of there. So just bringing those little feet up close and snuggling them in can help. And then the next technique, of course, is the I love you or the tummy massage. And so the first part is kind of comes down towards on her left side down towards the colon. The L is kind of an upside down L, so you kind of come across and down. And then the U, you just kind of come up from that right and around and down to the left. So you can do it that way. You can do the I love you, or you can do the just up from the right down around to the left and kind of make a rainbow. So this is just very gentle pressure. You're not going to push super hard, but you do push enough to kind of bring, it in kind of almost like an inch. And you can just kind of very gentle, and you just kind of run your hand around that large colon. And that can help that large intestine kind of bring the stool up, over, and down where it's supposed to go and come out. So again, not super hard pressure. You don't want to leave bruising. This is very just gentle massage, and you just kind of gentle and slow motion with it. So, yeah, we're probably gonna make you poop everywhere. And then the last technique, of course, is the bicycle. And with the bicycle, you just kind of gently grab a hold of the legs. And so you can do it a couple ways. You can just bring both legs up. So this is the first way. You can do it just like you're riding a bicycle. And it kind of brings those legs up to the tummy, and it just puts a little pressure right in here on the belly. And that can help them stool. And then the other way you can do this, if you'd like, is just to do both legs at once. And you just kind of bring them up and down and up and down. Little baby exercises. If they're ill appearing, if their belly's hard, if they just won't stop vomiting, they're not making wet diapers, bring them in. But otherwise, we'd really like to take care of you and kind of see them in a place that's, less dirty and, where we see babies more often. Because remember, the ER doctor's main job is just to make sure that they're okay and they're not anything critically wrong. Whereas we may be able to, at the clinic, get you more tips and tricks to help. So yeah, at any point, if, the breakdown is basically at any point, if you're ever concerned, just call. We have great nurses. We have great doctors. We will figure out a time to get your baby in. We have a well baby clinic that honestly does walk a lot of babies in. And so if anytime the parents are concerned, we can just bring them in and weigh them and check them out.